The United States isn't vaccinating people quickly enough, and the government is missing its projections by a lot. Members of Operation Warp Speed say they need to do a better job of getting shots to people who need them. KMBC 9's Bree Jackson has a story from Washington.
The Trump administration says it delivered 14 million doses so far, but federal data shows that far fewer Americans have actually received shots. Operation Warp Speed's vaccine rollout is off to a slower than expected start.
We know that it should be better, and we're working hard to make it better.
The Trump administration projected it would vaccinate 20 million Americans by year's end. With less than 2 days to go, the Centers for Disease Control reports just over 2.5 million people have received their first dose, drawing criticism from President-elect Joe Biden this week.
The Trump administration's plan to distribute vaccines is falling behind, far behind.
Administration officials saying a lag in reporting is to blame for low vaccination numbers.
That data will tighten up as the systems and reporting becomes more regular and routine.
Those overseeing vaccine logistics say they've distributed 14 million doses so far and are on schedule to reach 20 million doses delivered by New Year's Eve. Meanwhile, states are moving forward with administering those shots.
While it is lumpy and bumpy, which we said it would be, it's moving forward, and it speaks well to what's ahead.
With COVID hospitalizations and deaths climbing to record highs, officials say getting more doses in arms is critical.
Every day we have to keep pushing forward to ensure safe and effective vaccines are available to the American people.
And right now, most vaccinations are at hospitals and nursing homes. Operation Warp Speed officials say they plan to ramp things up in January, which includes vaccine distributions to pharmacies nationwide. In Washington, I'm Bree Jackson.
And take a live look at your screen right now. You are just about to see Kansas Governor Laura Kelly get her first dose, her first shot of a coronavirus vaccine. Live pictures from Topeka right now. The nurse getting ready. And Governor Kelly there has her arm out, ready to go. This is really a monumental occasion. We know the state has been prioritizing healthcare workers, first responders, frontline workers to get these shots. But today's vaccination, as you see it being taken from the vial there, is part of a plan to just make sure that the state government can run smoothly in the pandemic. Of course, the governor at the top of that food chain as the needle goes into her arm and the governor gets her first vaccination. And she'll get her second dose in a few weeks. Let's take a moment to track the coronavirus impact in our two states. Positivity rate, one of course, the best ways to see how the virus is spreading. In Kansas, the average positivity rate is now around 12.5%. That is the lowest we've seen it in 3 weeks. In Missouri, an average of 17% of tests are coming back positive. That is relatively flat compared to what we've seen in the past week. Missouri Governor Mike Parson says 66,000 people have received their first dose of a vaccine in the Show Me state, including healthcare workers, along with long-term care residents and staffers. Today, the governor was asked about hospitals reporting vaccine shortfalls compared to what they were initially promised.
There is a plan in place, so if you want the vaccination and you can handle the containments of it and you can handle the amount of doses, we want you to have it because we want it in people's arms. That's where we want it. So we're doing everything we can. So again, I think as those vaccines come in, one of our priorities is make sure somebody's utilizing just as quick as we can. So those numbers are going to continue to go up.
Governor Parson says the people who got the first dose of the vaccine will begin the process of getting their second dose next week. Today, Midwest Health held its first vaccinations in the metro at an assisted living facility in Lenexa. KMBC 9's Emily Hallwick shows us how it's bringing much needed hope to the people who live and work there.
Cheryl Swiden can't wait to hug her mom, Dolores, again.
I've been able to see her weekly through a window.
The 94-year-old lives here at Homestead of Lenexa. December 30th was a historic day.
I can't believe it's happening already.
Residents and staff received their first dose of the Pfizer COVID-19 vaccine. Dolores was eager to get her shot.
It was about as easy as you can imagine.
Although isolation has been hard, she's stayed strong.
I just don't get down. I just keep thinking about the future and things I want to do.
The vaccine evokes cautious optimism.
We all need some good news. This is better than Christmas.
In a word, I think we're all just extremely hopeful.
Allie Ellis with Midwest Health says residents were ready.
It's really just because this has been such a tough year. It's been such a long year. And until now, there didn't seem to be an end in sight.
Cheryl is looking forward to moments big and small.
Just to go in and help her, do personal little things that, people haven't had time to do, or things that, she and I would do.
She and her mother hope others will roll up their sleeves too.
I just can't imagine why anyone wouldn't want it.
Emily Hallwick, KMBC 9 News.
Vaccination dates have not been set for the other Midwest health facilities in Johnson County, Kansas, but organizers expect them to be scheduled soon. It's being called the vaccine of the world. Britain is the first country to greenlight AstraZeneca's vaccine. Many countries are expected to rely on this version because of its low cost and easy storage. Company will sell the vaccine for $2.50 a dose and could produce 3 billion doses by the end of the new year. People will need to get 2 doses spaced between 4 and 12 weeks apart. 3/4 of England just went under tighter COVID restrictions, all because of a spread of a new strain of the coronavirus. Cases are up 32% compared to last week. Hospitalizations are up 18%. Colorado and now California are reporting cases of the new variant stateside. And with these discoveries, there are questions about whether we should take more precautions to stay safe. Doctors at the University of Kansas Health System took that up today.
I still feel safe with what I'm doing in the hospital, even if we had the UK variant patients in the hospital. I would still feel safe. Again, it's going to be distancing as much as possible, 8 to 10 feet if I can. If I need to do an exam or a procedure, I will do it at that point. That's a very short amount of time. It's not going to be 15 minutes or more.
Doctors urge you to continue masking if you must go out. Don't gather in large groups and stay within your bubble.